Frustration is growing for some 9/11 survivors and first responders who have been frozen out of access to life-saving health care due to Trump administration funding cuts. Here to explain is CBS's Bradley Blackburn, who's been following the developments all day. What do we know now? What's the status of this now, Brad?
Well, John, this is the second time since DOGE cuts started that this World Trade Center health program has been in the crosshairs. So back in February, multiple jobs were eliminated, and then after a public outcry, HHS said they would be reinstated. But according to advocates last month, another 16 jobs were eliminated. And it matters, they say, because it's frozen things for new participants in the program. They can't do things like enroll in new benefits. They can't certify certain 9/11 related health conditions. And in some cases, they can't get approval for necessary treatments, including chemotherapy. And again, this is getting a lot of attention, and there is some reason to hope. Tonight, I spoke with the FDNY, and they said they're hearing from Washington that approvals and certifications could begin again as early as tomorrow.
Let's hope so. But in the meantime, delay, freezing, what does that do in terms, what's the impact of that?
Yeah, there are people in every state across the country that are in this program, more than 142,000 enrollees, and they add another 800 every month. The vast majority of those people do have a certified 9/11 related health condition. And this is frustrating for advocates because they fought for this program. It was approved by Congress. It was supposed to be funded all the way through 2090. Here they are still fighting, and they're worried that this back and forth, these delays could ultimately cost lives.
Yeah, I imagine some viewers are like, wait, didn't we already have this conversation? It's been 24 years. You mentioned 800 new enrollees. Why does that happen 24 years later?
Yeah, I've met some of the participants in this program, and oftentimes they don't think to enroll until after they're diagnosed with a serious condition. So I met one retired NYPD detective last year. He told me he didn't even think to sign up until after he was diagnosed with stage 4 throat cancer. And he said he didn't do it earlier because he wasn't sick. And there is a mentality among some first responders that they don't want to sign up and possibly take something away from people who really need it. But the reality, John, is that because of toxic exposure down at ground zero, many of these conditions are just starting to show up all these years later.